Hello, hello, hello. Good morning. Happy Monday. Happy Mental Health Monday. Good morning. Happy Monday. Welcome back to another week, another day to continue talking about how to take care of our mental health. Welcome back. For those of you, this is the first time that you wish this channel. I do encourage you to stay for the whole video, because this video, not only we talk about mental health, we talk about mental wellness, we also drop at the end of the video, I go over a therapeutic technique that you need to learn, you can learn to continue taking care of your mental health. So make sure you listen to the whole video, because at the end of the video I do go over therapeutic techniques to learn about mental wellness. So like I say, I'm going to do something different this year. So this year I want to focus more on mental wellness. I know last year I went over many mental illness, I went over many mental problems, but this year I want to focus on mental wellness. So this year I want to have conversation. I want to answer you guys' questions. I want to blend therapeutic techniques during my video so you can learn and you can practice, because that is the reason I opened this YouTube channel. I understand that everyone seek therapy. I understand that everyone can afford therapy. I understand that everyone feels secure enough to seek therapy, but I'm hoping this is not therapy, but I'm hoping I can give you guys some therapeutic techniques. I can give you guys some wellness so you can continue taking care of your mental health on your own. For those of you who do not know who I am, my name is Krista. I am a licensed clinical social worker with over 10 years experience working in my community as a therapist. I work as a family therapist. I work as a couple therapy. I work with children. I work with adolescents. I work with adult. I work with substance abuse, addiction, foster care. I also manage different programs. Right now, what I do as a role, I'm a behavioral health consultant, and I continue working in my community as a therapist. That is my role. If this is the first time you watch this channel, again, watch the whole video, and if you do like the conversation, do not forget to subscribe. And if this is not the first time you are a return individual, do not forget to like and do not forget to comment. I want you to comment on those videos that you understand or you want more, or can I go over certain things with you, because this year I want to open the channel where I can continue explain things to you guys. Before I go over to the conversation that we have today, I normally stop here in my video and ask you guys, what did you do last week to continue taking care of your mental health? What did you do? What did you do last week to continue taking care of your mental health? Last week, I taught how to do deep breathing. So that's what I did to take care of my mental health last week. Last week, throughout the week, I implemented deep breathing. So last week, how I teach the deep breathing: inhale, hold, exhale. I teach the 4, 7, and 8. That's what I taught last week, and that's what I did throughout the week to continue taking care of my mental health. I take deep breathing. If you want to know about this technique, you can watch the last video that I dropped last week. So for this week video, I want to answer 2 big questions that I get all the time. I get those 2 questions all the time in my as a therapist, every ward that I'm in the clinic, I get those questions from Haitian, I get them from Spanish, I get them from white, black. A lot of people ask me those two questions. So this week, I want to answer those two questions to you guys. And I also have a techniques that I'm going to teach in this video. Like I say, stay with me, watch the whole video so you can learn the techniques at the end of this video. So one of the questions that I get a lot, and people ask it different way. I have different way that people ask that question. They ask it. I hear people say, when do I know how to go look for a therapist? When do I know I need a therapist? When do I know that my children need therapists? Does everybody need therapy? I get that question all the time. And with the ego and with my bias, because I'm a therapist, and with my arrogant almost, I normally answer, yes, everyone needs therapy. Yes, dominate to me with my arrogant and my bias and my own, my own way, because I'm in the mental health world. I will tell parents, I encouraging you, after your kid past 6 years old, for you to get your child evaluation. And you guys hear me say that before. I say that all the time. I'm like, yeah, when you have your children, when they turn 6 years old, I will encourage you to get them an evaluation to making sure you rule out any type of developmental issues, like things like autism, ADHD, ADD, any issues, intellectual issues, speech issues, developmental issues, developmental condition, like get them an evaluation, making sure your kid is good. And then with my arrogance and my bias, I will tell parents, yeah, before your kids turn 14, because I know the statistic. The statistic, before a kid turn 14 years old, they're already experiencing with childhood adversity. So before 14, that kid's already probably, if it's a girl, probably have period. They probably already have some heartbreaking. There's friends, they already have changing friends. Sometimes they already change in different school. Sometimes they already change in different home. Sometimes they might already have divorce, parenting divorce. Like certain things that to us, it's not a big deal, but to our children, it is a big deal. Those kids are already experiencing it. They're already experiencing the parents that yelling at them. They're already experiencing the parents that beating them up. They're already experiencing their parents. If their parents' mental health is wild, it's not healthy, that kid by age 14, they already experience some things in this world. So easily, I'll be like, yeah, if a kid's around age 14, yeah, they need therapy. Especially if my patient is telling me, oh my God, because they turn 18, it's like I have a little devil. They don't eat well. They sleep all the time. They're always in the phone. They're not doing good at school. And I'll be like, yeah, they need a little therapy. Easy. Just like with all my bias. And then I will easily sometimes say to a person, oh yeah, by the time you turn 25, after 14, you need to seek a therapist, because you already live a good amount of years on this earth. And then by age 25, their brain, it's not finished developing, but it's in a good part of developing. You probably already went through some breakup. You probably already went to a lot of rejections. You probably already you trying to figure out what is your purpose in this world, what is your purpose on life. You probably getting a lot of rejection from men or women. You probably trying to get a healthy relationship. Some people by age 25, they'll probably already get children. They're probably already married. Like there's a lot that's you already done by age 25. And I will encourage you easily with my arrogance and tell someone, yeah, Like, you should already be in a therapy at that age. Like, should. I always say should is a strong word. But, with my arrogant and my bias and my, like, like, and I'll say with my chest too, that you need to be in a therapist, easy, like, right? And then when someone come to me by age 35, someone come to see a therapist by that age, in my mind, I already know I'm going to go all the way back to see their life and see what can I clean, because I already know how much they already endure. And then sometimes people will come to me, especially in my role right now, they'll be like, but Krista, I always have mental wellness. My life always went well, but I don't know. I turned 30 and things went soft for me. Or I turned 40 and things go wild for me. Or I'm 50 now and it's like every news I hear, I'm shaking. Like my anxiety is through the roof. Or I'm 50 and then I end up have to go to crisis because I couldn't deal with sadness. Or I'm 60. The worst age for me, 70. And they come, it's like when they come in therapy and consult by age 70, oh my God. Like sometime when I went after a consultation with someone that's like 70, 75, 80, I always need 5 minutes break. Because they drop so much by that age. They'll be telling me, oh yeah, when I was 13, I was sexually abused. And then by 25 or by 22 or by 14, I came to America. And then I struggled and my parents, and they did that. And then by age this, and then I end up getting a man that was beating me up. And then I left my first husband. And then I go to a second husband. And then second husband touched my kids. And then it's like so much. And then they're like, but I was undo it all and I was doing everything. And then, but at age 75 now, I don't know what's wrong. I can't sleep. I can't control my weight. I'm hurt everywhere. My shoulder hurt. And it's like death, and my children, oh my God, Krista, my children, they're in drugs. They're in prison. Of course, they're bleeding, the children, because of their lack of mental wellness. And their grandkids, and it's like their life, it's so much. And then of course, with my arrogance, I'll be like, you need therapy. But most of my patients at age 75, they don't go. They're like, what is wrong with this lady? Like, I just have diabetic, or I just have hypertension, or I just can't sleep. It's okay. It's all age. Or I just waking up in panic mode, or I'm always panicking. It's okay. Or I'm now eating like crazy. It's okay. But me as a therapist, I always see, I always see when I say bleeding, I always see the bloods. I always see the mark. I always see I always see the things when they are saying, I see the evidence. I see the evidence. I see the outcome of their mental wellness. But easily, I always mention to people, oh yeah, everybody needs therapy. Everybody needs to go to therapy. You need to go, right? With bias. But last week, I was having this conversation with someone. And they made me think. And I never thought it that way because, again, I'm a therapist and my bias. Like when you go to a doctor, the doctor wants you to go to the doctor, right? And yes, I'm aware not every doctor and every therapist, everyone is good. I'm aware of that. And I'm also aware not everyone trusts therapists and see and things like that. I'm aware. And I'm also aware not every therapist explaining to their patient what they're really doing. And I'm also aware not every patient understanding what they are doing. And that shouldn't be. And again, it shouldn't be. A patient should not be coming to me and seeing me as a therapist and coming every week and they do not know What are they doing? They do not know why they are paying me. But this person that I was having a conversation with, he said, but Krista, sometimes a therapist need money. So even if I'm good, even if nothing is wrong with me, this therapist might make me telling me something is wrong with me so I can keep coming and paying. And I was giving my example of dentist because I always give that example. And again, that person challenged me. That person was happened to be a Haitian, because you guys know I'm in my community. I'm like trying to break stigma in the Haitian community. So I talk to a lot of Haitians about their mental health. When I can't find one, I'm always talking. And he's like, so I give him the example of the dentist. I'm like, yeah, we all go to the dentist. He's like, He's like, I was 30 years old when I go to the dentist. And of course, I didn't grow up in America. But because I work in America and I go to school in America, I kind of like learn the system of America. And sometimes I assume every Haitian in this country is going that way. But of course, that's the reason I'm trying to break the stigma in my community. So let me explain to you guys, for some people who doesn't understand the system of America. So the system of America, the minute you have a child, when you give birth to a child, even before you give birth to your child, when you're pregnant, there is a lot of appointment. Tell me if I'm wrong. There is a lot of appointments. In Haiti, there is not that much of appointment. In Haiti, you might be pregnant. You go the first time you actually go to the doctor, it's when you're giving birth. And sometimes you might not even go to the doctor if you're giving birth. I know back in the day, but now it can be new. But back in my day, when I was born, okay, I was born in 1986. Back in my days, okay, sometimes you might not even go to the doctor if you're pregnant. You might have a midwife that can help you give birth. Or the first time you go to the doctor might be when I'm giving birth. Or you might go to the doctor, but not as often as here they're making you going. Sometimes every trimester, they're making you go into the doctor when you're pregnant. And if you have diabetic, high blood pressure, you're at weeks, something is more, you go more to the doctor to see. And after you give birth to the child, the first, we call it newborn appointment, you go to the doctor with the child. And some clinic now in United States, when you go to the doctor to your child, you speak with someone like me. They call it newborn consult. For us, we also check behavior things. So what are we checking in the home with this new baby? You speak with a social worker. You might not know you are speaking with a social worker, because again, sometimes when a Haitian, when I introduce myself, they're like, why am I speaking with a social worker? I have to explain, because again, I love educating. I am explaining why they are speaking with me. And sometimes when I'm speaking with my Haitian community, I do find some stress. And that is the reason they're talking to me. I am making sure this child have a place to sleep. They have support at home. They have a plan if they're going back to school, to work. When are they going to back to work? Who will be watching the baby for them? How are they planning to feed the baby? Right? And sometimes I'm finding out, my Haitian community, they are stressing about immigration, they are stressing about going back to work, they are stressing about money, financial, they are stressing about their husband is the only one who's working right now, and because they're not working, their husband might not be able to afford. They are stressing about some of their job is not giving them time. Why? So I am supporting them in that moment. But not a lot of my Haitian understanding what's the point of me. Sometimes I'm the one who's like, oh, let me see if they can find a crib. But they don't know that I am a therapist. They don't know I'm here for mental health. They don't know I'm here for behavioral health. They don't know I'm here for mental wellness of themselves and their children. They just know, oh, this is the person who helped me get in bottle, or who helped me get in crib, or who helped me connecting my baby to school, or who helped me with the speech. Like, that's all they know. But they don't know I'm a social worker, right? So let's keep going. Stay with me. I don't want you guys to lose the point I'm making. I am answering when someone should be going to therapy. That's the question I'm answering. Now, after you giving birth, the kids go to the doctor for the newborn appointment. 3 weeks later, the kids go to the doctor. 6 weeks, the kids go to the doctor. 4 months, the kids go to the doctor. 6 months, the kids go to the doctor. 9 months, the kids go to the doctor. If you faithfully with those appointments, that's how it's supposed to be. 9 months they go, 12 months they go, 15 months they go, 18 months they go. When they turn 24, which is 2 years, they go. 1 and then 2, they ask me to make sure there's no delay. 2, they go. And then from there, the kids go into the doctor every year. In United States, if they have to go to school, you have to show a physical, an annual checkup to the school. If they're going to private school, public school, whatever, you need an annual checkup. So which means every year that kids need to go to the doctor. So every year they're checking up, they're checking the eye of that kids. Some clinic, they check everything. They check dentist, they check eye, they check bones, they check everything. Now, if there is something wrong with that child, because I remember that's how I end up getting glasses when I was in this country. If there's like, they do the eye checkup and then the kid need glasses, they tell you the kid need glasses. When I was younger, I need glasses. When I was younger, they say I was too skinny. When I was younger, they say I was dehydrated. Like they would tell, when I go that once a year for that checkup, they would tell something is wrong. Now, if something is wrong, keep going. Now, sometime in the clinic that I'm consult, I find a lot of people in not just my culture, I find a lot of people that they skip a lot of those doctor's appointments with their children. And sometimes they say things like, I don't have the time to go to those appointments. I don't have transportation. I don't have the money to pay every time I see the doctors. I cannot take those days off. So sometimes they skip a lot of 4 months, 6 months, 9 months, 12 months, 15 months. They skip a lot of those. The next time, sometime after the newborn baby, we might find this person again, these kids again. It's when they turn 5 years old and they go into school for the first time. And the school need a physical for that kids to see the doctor. Sometimes that's the next time. Sometimes I will get a patient, that patient come when they were a newborn baby. And the next time I see that patient come to see the doctor, it's when they turn 5 and they were going to school. And there's all those appointments that I just said, they miss all of it. And the reason, because again, I'm a social worker, so I ask, what is the reason you miss all those appointments? And they told me. They say, I don't have transportation. I cannot take the days off from work. Why am I coming to those appointments? Sometimes they don't know why. They don't know what's the reason they have to come to all those appointments. They do not understand it. And then sometimes they tell me they don't have the money. They don't have the trust. Like, they tell me the reason. Why? Because as a social worker, I ask why. The doctors sometimes don't ask why. They have too many people anyway. They don't ask those things. And then sometime when I'm getting those kids at 5 years old, then that's when there is a delay. That's when sometimes the kids are not speaking when they were supposed to speak. That's when sometimes those kids are not potty training when they should have already learned how to potty training by age 3. That's when sometimes the kids are walking in tippy-toe when that's not common. That's when sometimes some other stuff. Sometimes I'm here, oh, the terrible two, when there's not a terrible two. It's because there's no parenting, right? Stay with me. Stay with me. I'm answering the questions. So, to answer that question, just because you as a human being doesn't check your mental health, your emotional health, your psychological health, your spiritual health, your social health, like I believe you should, which is every year, doesn't mean it's not there. So when I'm saying I want you guys to check your mental health every year, is because as a mental health person, as a therapist, I know what you're supposed to be looking for. I know what question you're supposed to be asking. But just because you do not show up, just like you did not show up for your kid's physical appointment, doesn't mean it's not there. That's one. Second, if yes, you do not have the money to do the checkup every year for your kids, because therapy is expensive. A psychiatrist evaluation, a intake appointment is expensive. You might not have the insurance for it. The kids might not have the insurance. You might not have the time for it. Doesn't mean you or your children doesn't need that wellness checkup. Okay? Now, if you go and this therapist tell you, you go for that intake, okay? Because I remember when I used to do full-time therapy at a consult, there is job that was sent. There's a lot of jobs, like if you work for the government, that will send the employee to come get a intake appointment. So they need to do a bio, psycho, social evaluation. And just like you hear it, that's exactly what I mean. I check their bio. So I say, where were you born? Who was your parents? How did you born up? I check their bio. I check the psycho, right? While the psychiatrist, the psych, and I check the social. I did an evaluation on this person. A lot of government job requesting an evaluation on the staff. And after I did the biopsychosocial evaluation intake, and I used to get a lot of those. When I used to work in a community health center, I used to get a lot of those because it used to be a little bit cheaper coming to a community health center to get a psychiatrist evaluation. And because I'm a licensed clinical social work, they normally need one to be done by a licensed individual. And sometime after I finished doing a psychosocial, after I finished a biopsychosocial evaluation in the individual, I said, sometime, I said, you need therapy, my friend. Another doctor that's normally sent people to get a evaluation, it's when you are going to do any type of weight loss surgery. Okay? So sometime I'll get those as well. I'll get a lot of intake for individual that's trying to do a weight loss type of surgery or a weight loss type of treatment. And after I do that assessment, I will tell the individual, you need therapy, my friend. Your weight, it's not managing by, like you're not managing your weight and it's out of control, not because it's because, poor relationship with food, but there is more issues here that make you lead to overeating. Or after the government job, I'm like, you need therapy because la 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 la. And sometimes they're like, what? I spend all my life and I never need therapy. And sometimes they will not come. They will not come. Sometimes I will not sign in that they can do this job, or sometimes I will not sign in that they need to do the evaluation. And most of the time they hate me, especially when those people is court order to do evaluation. When they court order and I'm like, yeah, they need therapy, they need 6 months therapy, at least they will not come back. They will not come back for therapy. But that doesn't mean you do not need therapy, right? And then this person tell me, the person that I was having a conversation with, he said, I will go to my dentist. The first time I went to a dentist, because I take the example of the dentist that you need to go to your dentist every 6 months or whatever. And he's like, sometimes people are eating, or sometimes it's people, like nothing is wrong with me. People just want to make money. Because at the end of the day, as a therapist, you need to make money. This is your business. You need to get paid. I always tell people, believe me, since I've been a therapist, I never short of, and I don't know if it's because I always work for nonprofit, but I never short patient. Having patient, sometimes I'm the one who's telling people I don't need patient. I never short patient. So I never, and I don't know for people who's in private practice, if money, if that is, if that is like a thing. But I have a lot of clinicians. In my phone alone, I have like 400 some therapists, clinicians, and half of those people is on private practice. They're never telling me they're hurting for money because they're expensive. For a session, like if I will be doing private practice, and I know sometimes my video is less than an hour, but for an hour, if I know I have 293, you might not be able to afford me for free for an hour to do therapy with you if I'm doing my own private practice, because we are expensive. We go to school for this. We are scientists. So we are scientists with emotion. We are scientists with brain. So, and we have ethics. So there is no way, if you are telling me, okay, just like again, that conversation I was having with this gentleman, he said, I went to the dentist first, they make me spend $700. And then after that, they tell me I have to spend 1,000 something. And then after that, they tell me every 3 months that I need to come, I need to spend 200 to get my teeth clean. And I was like, okay, let's stop right here. Because all that individual was saying is like, I'm spending too much money. And then I have to take days off to go to the dentist to get my teeth clean, because I was taking my example of the dentist. And I'm like, okay, but let's stop. Why did you go to the dentist in the first place? He said, I go to the dentist because I was in pain. I have a toothache. Like I was in pain. I got headaches. I'm like, okay. And you told me for 30 years, you never see a dentist. Which already tell the dentist, because I'm just taking an example of a dentist for a mental, which tell me if you spend 30 years, you never seeing a therapist, there is already telling me so much that needs to be happening. So when you go to that dentist open your mouth, that dentist probably sees so much. If you're already in pain to go to the dentist, and the mental health world, that means you're already in crisis. That means you're already crazy, like people is loving saying. So you in crisis mode. Okay, your nervous system is already on whack. Okay, so that dentist see all those things, and maybe the dentist didn't communicate it well, which I hate. Me, I go to the dentist, I tell the dentist needs to tell me what's going on. They need to show me. So maybe the therapist that they go to, maybe the dentist that they go to doesn't explain everything, right? But that dentist probably already see, or, because I'm like, okay, why did you pay $700? First of all, they didn't have insurance, right? And the dentist is expensive. So they pay $700 to take all picture, right? Or picture of the teeth, which is the evaluation in the mental health ward, and to see what's really wrong, to see all the volume of the gum, right? And then they pay 700 for all that. And then I'm like, okay, and then what's the reason you pay 1,000 something? Which I remember when I was taking all my wisdom tooth out, I paid more than that. So that dentist sent them to get surgery and to take all their 4 wisdom tooth out. Which sometimes someone come to me as a therapist, they are so far gone that I need them to go to another specialist. Sometimes I need them to go to a psychiatrist for medication management, which is more money than I. Sometimes I need them to see a neurologist, which is more money than I. And sometimes I need them to see an EMDR, which is trauma, for a couple of weeks. Sometimes I even boost them to another type of therapist that specializes on what they're doing. Sometimes I even have to move this patient to another place, because if that patient is going through domestic violence, sometimes I need that patient to go to a whole shelter, right? Wishes can be a little bit more chaotic. And sometimes when I do all that, or sometimes I have to call the police on that patient because that patient told me they want to hurt themselves. So I have to keep that patient safe and everyone else in their home safe. And sometimes they don't come back to me, but it costs them more. Imagine if a patient come to me for the first time and they tell me yesterday they tried to kill themselves, and then while there I call the police and they have to go to inpatient for a week, which means they can't work for a week. Then it costs them a lot. And when it costs them a lot like that, sometimes they don't come back. But that doesn't mean you don't need to take care of your mental health. Sometimes when I'm calling them, how's everything after the hospital, they curse me out. So I'm going to teach a tools that actually, like I mentioned to you in the beginning of the video, I want to continue teaching therapeutic tools that you can implement it to help you with your mental wellness. Today, the tools, the techniques that I want to teach, it's called thought stopping. The thought stopping techniques go like this. So the thought stopping techniques, it's when sometimes we have some negative thoughts. We have some destructive thoughts. We have some unnecessary thoughts that doesn't make us feel good, and that doesn't have good outcome. And I hear a lot of my patients say, sometimes, like my thoughts drive me crazy. My thoughts just like go, it's one and one and one. And sometimes it's like I go to bed and my brain is just going and going and going. And it doesn't make them feel good. And the feeling doesn't feel good, and the outcome, it's not good. So I'll give you an example. Example is like, let's say, and I have that a lot with adolescents, oh, I'm ugly. They always have those thoughts, I'm ugly, I'm ugly, I'm ugly, I'm ugly. When they think they're ugly, they feel sad. They feel like they're ugly, right? They feel ugly. They don't feel love. They feel dislike. They feel hate to themselves. They have that self-hate injury. And when they have that feeling, now they become insecure. They start having low self-esteem. They become embarrassed and ashamed. And then some of those outcomes, you might see they don't do well at school. They don't talk to everybody. They don't go places. They cry a lot. They're trying to dress really bad, or they're trying to dress really, like really aggressive, like very showy and things like that. Why? Because they don't like the way they look. Now, how do we teach those thoughts? When I'm teaching the thought stopping, I said you have to be able to identify the thoughts that doesn't make you feel good. You have to have that self-awareness. So if you identify, I'm thinking I'm ugly, you need to say, stop. to the thoughts. When I'm teaching kids, I will even make them draw the thoughts. I will even make them saying it, like stop, stop. Like I will make them say the word stop. I will make them imagine the word stop when I'm teaching the kids the thought stopping. But when I'm teaching to adult, I'm like, once you identify those thoughts that doesn't make you feel good and that doesn't have good outcome, you need to say to it, stop. And it to be a strong stop. And once you say stop, you need to say, okay, when I'm thinking I'm ugly, what feeling that give me? You need to be able to identify those feelings. And I know a lot of us does not have feeling, and I'm one of those people, do not have feeling vocabulary. So I will, well, when I used to have the office, I would have the wheel of feelings, but sometimes I will have a list of feelings, and I'll say, okay, which feelings, which one you feel, right? And then they will identify 5, and if it's kids, I'll make them color it. Like they will identify like 5 different feelings for me. Oh, I feel sad, I feel nervous, I feel embarrassed, I feel unworthy. Right? They will color the feelings, or they will pick out the words of the feelings for me. And once they're picking out the words of the feelings, and I'm like, okay, when you feel this way, what is the outcome of that feeling? And they'll tell me, when I feel sad, I end up staying in my bed and don't go anywhere. When I feel sad, I end up not doing my hair. When I feel sad, I end up not working out. When I feel sad, they tell me the outcome of that feeling. And then I'm like, is that what you want? That's not what they want. Okay. Now, what else can we think instead? And then I'll create with them. What can they think instead? And sometimes those thinking can be because I don't ask my patient to think just positive. I ask my patient to think constructive. I ask my patient to think like necessary. So if that kids and then that adolescents or even adult, because when they close door, they told you that, like they believe they're ugly and they think about it all the time. And it can start even when they were young, but it stay with them even if they're 40 something. And then I would say, okay, when you think that, we're going to say stop to that thoughts, because we already identified the feeling is not good. We already identified the outcome. The outcome make you eat more. The outcome make you don't work out. The outcome make you buying ugly clothes. The outcome make you showing your butt or your boobs and things like that. Or the outcome make you people pleasing. Or the outcome make you get into a relationship that you don't want to get into, right? So let's break that. Now, when we think we ugly, what other things we can think? Oh, you know what? Okay, let's take a mirror. Sometimes they can't. I guide them. Let's take a mirror. Let's look at yourself. Is there anything in yourself that you like? Oh, you know what? I like my hair. Oh, like what? I like the color. You know what? I like my teeth. Oh, you know what? I like the day. Oh, no, you know what? Da, 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 da. Okay. And the other stuff you don't like, if we think about ways to change them, what we will do? You know what? I do not like my weight. Okay, then what can we do? Oh, you know what? Maybe I can eat better. Maybe, you know what? I can work out. Yo, you know what? Maybe I can change my outfit. Because there's some people, is the way they're built is because they're wearing the wrong outfit that make them look like the outfit they're wearing is not good for their body. Right? So, okay, maybe I can do this, or maybe I can get a trainer, or maybe I can pay for my gym, or maybe, they start thinking things that give them great result. And I'm like, okay, and when you think that way, how does that make you feel now? I feel hopeful. I feel happier. I feel like I can trust myself. I felt like, and then they say the feelings. Okay, and when you feel this way, what is the outcome? I am more motivated. I actually go to the gym more. I do this, I do that. So that is the technique of thought stopping. Okay, I just did it with you guys, like I was doing it with a patient, right? So we stop those negative thoughts. We stop those thoughts that doesn't make us feel good. We stop those thoughts that doesn't grow our life, and then we replace it to necessary thoughts. We replace it to constructive thoughts. We replace it to thoughts that get us to move. Okay? Sometimes our own thoughts keep us in one place, right? Like even when I'm having a conversation with a DV, domestic violence patient, right? Their thoughts might be like, they might sit there and say, you need to leave him, 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 you need to leave him. But if I leave him, where do I go? Who will support me? Who will support me? Who will support me? And then they sit there and then they spend years, they never end up doing the things that they want, and they're actually feeling more bad. And when we do the thought techniques, we kind of like organize their thoughts for them, okay? And we assist them, and it's with them, because again, therapy, it's a we thing. Therapy is not like the therapist work hard and then you not work hard. I quit therapy to a lot of patients that I'm like, I work hard, you're not working hard, I'm saying bye-bye. Like I was saying in the beginning of my video, I haven't found a lot of therapists that's like wasting their time with a patient just because they want the money. Doing therapy take a lot of us. It's exhausted. So I cannot say, okay, I have, let's say, there's sometime I used to have like 30 patients. I cannot say I have 30 patients and 20 of them don't need therapy, but I'm keeping them because I need the money. What's the point of that? When I could have replaced them to those 20 other people that want to do therapy. And besides, when you are seeing like the improvement, you do want to keep paying me. Again, if you come into therapy and then you don't see any improvement in your life, you're not going to want to come pay me. You're not going to send me, like, I never had a private practice. I don't want one because I love working with people that cannot afford therapy. And I never have a patient as my like I'm their therapist. And like I would have patients that say, Krista, I will pay you and pay you and pay you. Can you see me twice a week? Can you see me, like, I will have patients that I'm like, okay, you're done with therapy. And they're like, no, please don't let me go. Because I see so much improvement. I see how light my life is. I see how beautiful my life is. I don't want to let you go. What if I can't do it alone? I'm like, no, you have to trust yourself. We did the work. You have to do the whole practice. You're good. Like, bye. Like, you can check in once a year to make sure where you at. But you don't have to keep coming. Like, there is no reason when there's 8 billion people on earth that need help. There is no reason to keep charging people and to keep using people as a therapist because we need the money. That is unethical. And if you find a therapist that is doing that, that therapist is going to go jail time soon. Okay, I am sorry. Okay, so that is how the thought stopping go. And I do encouraging you guys throughout the week for you to practice the thought stopping. So when you identify a thought that doesn't make you feel good, you need to say to the thought, stop. You need to identify some of those feelings of those thoughts. You need to see what is the outcome of those thoughts and the feelings. And then you need to bring a mirror to yourself and say, how else I can think. So sometimes we cannot control our thoughts. Not sometimes, all the time. We cannot control our thoughts. And our thoughts sometimes, and most of the time, is telling us, pay attention, be aware. But we can manage our thoughts. We can reframe our thoughts. We can switch it around. We can decide how to think. We can decide in where is my mind going. And sometimes when I teach patients that techniques, they're like, oh my God, it's like I'm in control for the first time. Yes, you need to be in control because sometimes you are not your brain. I will have patients, especially patients that have thoughts that they want to hurt themselves. And when you teach them the thought stopping, and they're like, no, I'm in control of my brain, because our brain doesn't like pain. And sometimes the brain is telling you, you know what, I'm in pain, let's end it. But when you're like, but I love my children and I love my husband and I haven't lived this life and I want to see this, then you can be the one who is reframing your mind, and you end up being the one who's controlling your thoughts. And it's almost feel like you are in control for the first time when you are using the thought stopping. So thank you so much for all of you guys who watched the whole video. I know it was a little long. Thank you so much. And if you get here and you learn something, do not forget to subscribe, and do not forget to comment, and do not forget to like. Have a great week, everyone, and I will see everyone next time. Bye bye.